I am Thatnursingprof and welcome to my channel. In today's video, we're going to be discussing some common discomforts of pregnancy, what causes them, and what teaching we can give to our patient to hopefully ease some of that discomfort. So let's jump into our table. Our first discomfort is round ligament pain. The ligaments are being stretched because the uterus is enlarging, right? Everything's getting bigger, so it's causing the ligaments to stretch. Now, it's really important for a first-time mom, if you're taking care of a first-time mom, to let her know that this is normal and it can happen. Because what happens is, if you've never had a baby before and you've never been pregnant before, you don't know what round ligament pain is because you've not experienced it before. And sometimes it can be so painful and severe that they even mistake it for contractions, right? Because they don't know what contractions feel like either. So it's really important that we figure out, is this round ligament pain or is it contractions? And if it's just round ligament pain, letting them know that this is normal and it happens. And what can we do about it? We can tell them to avoid quick movements, so like quick jerky movements, okay? Support the abdomen with a pillow. And then don't bend over like this kind of bend over. Bend over to pick things up like this. Okay, do a squat bend, not a forward bend, like good body mechanics. Okay, those are some things we can help our patients with round ligament pain. Leg cramps are another common discomfort of pregnancy. I had these when I was pregnant both times, and it was like the worst thing ever. And a lot of times they happen at night while you're sleeping or when you're getting ready for bed while you're laying flat. That's what happens. And it's caused by the pressure of the uterus on the blood vessels. And then there could be a calcium-phosphorus ratio imbalance. So what can you do about it? Have them stand with their feet flat. So if they don't want to get up and out of their bed, tell them to, dorsiflex their foot in their bed. I'm doing it now. You can't see it because of the camera. But have them dorsiflex their foot, or have them get up out of bed and have them stand and kind of walk around for a little while. That's what's going to help with that. If it's because of this calcium-phosphorus ratio, then they need to adjust their calcium intake. Either increase it or decrease it. It all depends. It's an individual thing. If they are complaining of edema or swelling in the lower extremities, usually like their ankles or their feet, a lot of times pregnant women will complain of that. The cause is congestion of the blood vessels and an increase in fluid volume. So remember, we've increased our fluid volume, our blood volume. We have, 40 to 45% more blood in our body. So of course we're going to be a little bit puffy. And where's it going to go? It's going to go with gravity. It's going to be dependent. It's going to be in our ankles and our feet. So what should we do about it? Have them elevate their legs when they can. Have them avoid tight or restrictive clothing. And then try not to sit or stand for long periods of time. Our next one is dizziness. And if you watched my video on the danger signs of pregnancy, I do mention dizziness as one of the danger signs, but that's usually associated with other symptoms. This kind of dizziness is common, and it has two causes. One could be the compression of the inferior vena cava. So later in pregnancy, when baby's a lot bigger and has a lot more weight to them, if mom lies flat on her back, the weight of the baby kind of compresses the inferior vena cava, puts pressure on it, and can cut off the blood supply. Okay, so this can cause supine hypotensive syndrome. That's what that's called. So if this is the cause, you're going to tell her, don't lie flat on your back. Lie propped up with a pillow or a wedge, or lie on your left side. Your left side is more ideal because that's better placental blood flow. If that's not the cause, if the cause is postural hypertension, so her blood pressure drops when she goes from a lying to a sitting or a sitting to a standing, you're going to tell her to move slowly, okay? Don't just get up and go right away, okay? Get up, sit on the side of the bed for a little bit. When you feel ready, stand up and start walking, okay? So move slowly if you're having dizziness when standing. So our next discomfort is urinary frequency. Two potential causes. One is hormones, so HCG and progesterone, especially in early pregnancy. Or later on, when the baby's a lot bigger in later pregnancy, is the pressure of the baby on the bladder is causing urinary frequency. Now, unfortunately, this one is kind of unavoidable. We can't make this not happen, but we can make this a little bit more tolerable. When it comes to urinary frequency, some important teaching could be to decrease their fluid intake after 7 p.m. or after a reasonable time for them before bedtime. Now, it's very important that when you do this teaching, you're letting them know that you still want them to drink lots and lots of fluid, lots and lots of water throughout the day, but just maybe cut it back a little bit before you go to bed. So you're not getting up and going to the bathroom in the middle of the night 3 or 4 times. Maybe you're only going twice, okay? But make sure you're making that very clear. You're not saying limit all fluid, okay? You're just saying cut back before you go to bed. Another thing they can do is avoid caffeinated beverages. They really shouldn't be having caffeine anyway when they're pregnant, right? But caffeine does make you have to pee a lot. It does make you have to go to the bathroom more. So avoiding caffeinated beverages is going to help. Replace them with water. Our final discomfort is morning sickness. Morning sickness distinguishes itself from hyperemesis gravidarum. Hyperemesis gravidarum is like you need to be hospitalized, there's a fluid electrolyte imbalance. It's not normal or common. This is normal and common, okay? So don't get them mixed up. So what causes morning sickness? Unfortunately, that's kind of still up for debate. They haven't officially decided that yet, but there are some theories. The first of which is HCG. So HCG, if you remember, that's what we're checking for when you do a pregnancy test. You pee on the stick, it's checking for HCG. That's the hormone that it's looking for. Okay? And the idea is, they say people who have more HCG are more likely to have morning sickness. The other potential cause is low blood sugar, which if you think about that one, that makes sense too. Because when do most people have this? In the morning when they first wake up, when they haven't eaten anything. So low blood sugars are a possible cause of morning sickness. So knowing these two things, what are we going to teach our patients about morning sickness? Well, we can't do anything about the HCG level, can we? But what can we do? We can do diet. We can control the low blood sugar thing. So you're going to tell them to eat small, frequent meals to maintain a normal blood sugar level. So it's not too high or too low throughout the day, so keeping it stable and steady. And then those meals, they should avoid spicy, greasy, and fatty foods. Those are only going to exacerbate their morning sickness and make them more uncomfortable. Okay, so those were some common discomforts of pregnancy that your patients will report to you as the nurse, and some good teaching that you can give them to help hopefully make those a little bit more manageable. I hope this video was helpful, and if you have any questions or comments, please let me know. If not, I'll see you on the next one.